Good afternoon, everyone. Welcome to Understanding Asset Building and Benefits for People with Disabilities, Part 1. My name is Nakia Matthews, and I'll be your host for today. I just wanted to give everyone an important note about this webinar. This is the first of a two-part series. Access to Part 2 of this webinar, which will take place on September 19th at 3 p.m., is only given to those who have attended Part 1. Following this webinar, you will be sent a link and the password for Part 2. And I'd like to make a note, if you are listening by phone only and you have not logged into the web portion, please send me an email at nmatthews@ndi-inc.org so I can send you the info for Part 2. The audio for today's webinar is being broadcast through your computer. Please make sure your speakers are turned on or your headphones are plugged in. You can control the audio broadcast via the audio broadcast panel, which you see below. And if you accidentally close this panel or if the sound becomes unintelligible, you can close and reopen this panel from the top menu item by going to Communicate, Join Audio Broadcast. If you do not have sound capabilities on your computer or you prefer to listen by phone, you can dial the number that you see here, and I will also type this number into the chat box for everyone. Real-time captioning is provided during this webinar. The captions can be found in the Media Viewer panel, which appears in the lower right-hand corner of the webinar platform. If you want to make the Media Viewer panel larger, you can minimize some of the other panels like chat or Q&A. And conversely, if you want to make the Media Viewer panel smaller, you can minimize it. We will have a question and answer portion at the end of the webinar. Please use the chat box or the Q&A box to send in any questions you may have, and I will direct them accordingly at the end. If you are listening by phone and not logged in, you may also ask questions by emailing me directly at nmatthews@ndi-inc.org. Please note that this webinar is being recorded and that the materials will be available on our website on or after the airing of our second part, which is on September 19th. If you experience any technical difficulties during the webinar, please use the chat box to send me a message, Nakia Matthews, or you may also email me again at nmatthews@ndi-inc.org. I'd like to take a moment to thank all of the NDI sponsors, Walmart, Bank of America, Accorda Therapeutics, Burton Blight Institute, and our partners at the IRS. For those of you who are new to NDI, National Disability Institute is a national research and development organization with a mission to promote income preservation and asset development for persons with disabilities to build a better economic future. NDI's Real Economic Impact Network is an alliance of organizations and individuals dedicated to advancing the economic empowerment of people with disabilities. The REI network consists of more than 900 partners in over 100 cities in the U.S. and includes nonprofits, community tax coalitions, asset development organizations, financial education initiatives, corporations and private sector businesses, federal, state, local governments and agencies, and individuals and families with disabilities. And the REI network and its partners join forces to embrace, promote, and pursue access and inclusion of people with disabilities in the economic mainstream. I'd like to introduce our presenter for the day, Sharon Brent. Sharon Brent is a national expert on multiple federal policy issues related to the employment and self-determination that improves economic status of youth in transition and adult individuals with disabilities. From 2006 to 2012, she was Director of Training and Technical Assistance for the National Disability Institute and President of NDI Consulting. She is now a Senior Advisor and Treasurer of the National Disability Institute and remains the President of NDI Consulting. Her expertise is in youth and adult issues regarding employment, housing, healthcare, asset development, Social Security programs, DOL, HUD, and CMS programs. Ms. Brent has over 28 years of experience as an accomplished public speaker, curriculum developer, trainer, and advocate for people with disabilities. And now I'd like to turn it over to Sharon. Hi, Sharon.
Hello, Nakia. Thank you very much for the introduction. I am going to walk through here with you today the basics, and when I say basics, I mean basics for this 90-minute presentation, and I, again, will leave time at the very end of this first part for questions and answers, and I encourage you to send in your questions, and if we do not get to some of the questions today, I will respond by email if you continue to send your questions in. So that would not be a problem as well if you don't get all your questions answered today. I also want you to be aware that because we only have a 90-minute spot here, and then there's another 90-minute spot scheduled for September 19th, which is part 2 of this series, basically what you're going to get today is a big, huge overview of a subject that has got a lot of technical issues to it, but we will encourage you to continue your learning with some of the websites that we've provided for you in the PowerPoints that you're going to see as we go through this. I think what we're going to start with is the actual application process. You will run into folks who may already be on benefits, but then you'll also run into a lot of folks who have questions about the application process itself. And there's what I consider mythical facts, because there's a lot of people that get denied, but people make the assumption that as soon as you apply for benefits, you're automatically going to be denied the first time out. It occurs, that percentage, that large denial percentage occurs because of the lack of understanding in the process of the application system. None of us know something that we don't know. So the more we can learn about it before we start the process, the better chance we're going to have of becoming eligible for these kinds of programs initially. And we've given you some information here on this first slide. First of all, the Social Security Administration's website, which is a national website, is really very user-friendly. If those of you who are on this call have not visited that website, I encourage you to do so. The more you familiarize yourself with the access of information on that website, the more comfortable you will be as you start to learn more and more about this system. So you see the website we've got here, which is the www.socialsecurity.gov, and in that section there is an actual portion of their website that talks about the application. And there's a toolkit that you see here. There's a checklist for developing an initial application. There's requirements that help people understand what they're going to have to provide to meet the test of both medical and also financial, depending on which program they're talking about. So we encourage folks, the more information that you can learn about prior to the application process, prior to the application being submitted to the Social Security Administration, the better chance a person's going to have to not get denied the very first time out. There is definitions for disability that are both for both programs, which is the Supplemental Security Income and the Social Security Disability Insurance Program, and the medical definition that meets the disability test for the Social Security Administration is someone who is got the inability to engage in what the Social Security Administration calls substantial gainful activity, better known as SGA. This number changes, and we will start to see that new number for 2014 come out pretty soon. It'll come out the month of October, more towards the end of the month, may come out on their website sometime in the beginning of November. So you're going to be able to start to look to see what the 2014 number is, but the 2013 number is in a month. The gross wage that a person will be unable to earn is $1,040 a month, and for someone who meets the blind criteria, which is the criteria that belongs just to the Social Security Administration, that substantial gainful activity gross wage number is $1,740. And you can see on the bullet, the medical determination can be either physical, mental, or a combination of anything. I also encourage folks to incorporate everything that they have difficulty with. So where one person may focus on a very specific disability, and I can use the example cerebral palsy. Well, someone with cerebral palsy might also have high blood pressure, might also have asthma. So I encourage folks to incorporate everything that may prevent a person from being able to earn a wage. Also, if someone gets diagnosed with, for instance, cancer, and that diagnosis is going to result in death and it's going to occur prior to this 12 months, it would be important for people to identify that as part of the information so that the Social Security Administration can expedite the process of eligibility. The medical eligibility, again, for both the disability insurance program, better known as Social Security Disability Insurance, and also for supplemental security income, better known as the SSI program. Both of these programs are the two programs that the Social Security administers for people with disability. The medical portion of the evaluation and determination of eligibility medically is the same for both SSDI and SSI. Every state in the union and all of our territories that fall under our jurisdiction have what they call in their state a disability determination service. That is a contracted agent with the Social Security Administration that makes the medical decision in a state for the Social Security Administration. So every state has one of those disability determination services. They may call it something different, but the national term is Disability Determination Service. It also could fall under a medical, the Medicaid system in the state. It could fall under the vocational rehabilitation system in the state, but it's a separated contract with the Social Security Administration to make the medical decision only for someone who could be eligible in that particular state for SSDI or SSI. But remember, both those two programs are administered by the Social Security Administration and have federal jurisdiction, not state jurisdiction. The steps to the eligibility process, an initial claim, and you can see here that we've identified keeping copies is absolutely crucial. There are multiple ways for someone to apply for benefits. If someone wants to educate themselves even further prior to the application process, you could actually go into the Social Security Administration's website, and you can see that we've put in here what's called the Professional Blue Book. It is an absolutely full index of all the definitions of disability that the Social Security Administration has approved, and it will give you parameters of what a disability would look like if they fit one of those parameters. I encourage folks to use the language that's in the Blue Book when they're trying to describe their disability on the application to submit to the Social Security Administration. It's going to be important to complete all the paperwork and give examples of the disability and how it affects someone's daily activities. It would be pretty hard for a person who is unable to function in their daily activities to go out and figure out how they're going to go and get a job. So I encourage folks to actually think about how a person functions daily and use those examples. So don't answer just the questions yes and no. Actually give examples. Is there room on the forms to do that? Not necessarily, but I encourage folks to just add pages of information that help give examples of how a person may not be able to function. Going to the grocery store, dealing with public transportation, getting out of bed in the morning, anything that you can describe that helps describe the disability's details and daily function. Provide correct information about all the medical sources, so hospitals, phone numbers, doctors' offices, any kinds of physical therapy programs people are going to, could even be education programs. Do you need assistance to go to community college? All of those pieces of information become evidence that you can provide to help develop the case for disability. Responding to additional requests for information is going to be crucial. If they send you additional paperwork, it's important that you fill it out, copy it, and submit it timely. You also will have the ability to contact the Disability Determination Service. So where you see in this last bullet on this slide, DDS, Disability Determination Service, my recommendation is that people determine what that phone number is in their state and start to contact that office. They're the ones that are going to develop the case to prove medical determination. So they will go after all of the medical evidence, and they will develop a file on an individual, and they are the ones that are going to then go back to the Social Security Administration with their findings and recommendations as to whether they consider a person meeting the definition of disability for the Social Security Administration. The steps to eligibility usually follow. So if you submit an application, anywhere from 3 months to 6 months, you may get your first letter determining whether you are or you are not eligible. If you are not eligible, if you get denied the first time, you will have 60 days to file what is called a reconsideration. You file the paperwork, you add any additional information, then you resubmit again to the Social Security Administration. They again will submit the information to the Disability Determination Service. Another set of eyes in that system will review and go after any additional information that they did not get the first time. If you get a second denial, you will receive a letter from the Social Security Administration, and they will then offer you 60 days to file what is called an appeal, and that will then put you into the administrative law judge system. And it's part of the eligibility process, but that's where you will then wait to go onto the court docket to see an administrative law judge. What is the Social Security Disability Insurance Program? First of all, be aware that it again stands for Social Security Disability Insurance. So it's important that when you ask questions, it's important that you utilize the word disability insurance. If a person just says the word Social Security, if you're going to call the 1-800 number of the Social Security Administration, you're going to get responses on the retirement program. So it's going to be important for you to make sure that you use the words the Disability Insurance Program. It is also known as the Title II program. The Social Security disability benefits are based on a person's work history, looking at the length of time and the amount of money that they've earned in what is called FICA, which stands for Federally Insured Contributions Act. The Social Security disability insurance check amount vary from person to person based on how long you've been working and how much you earned while you worked. A person could also qualify for SSDI when connected to a legally opened work history of a parent. So sons and daughters who meet a particular criteria could qualify on their parental work history if their parent who earned the work history has already opened it. What is Medicare? Medicare is the health insurance when someone qualifies for a disability insurance payment 24 months after the date of eligibility. Medicare becomes their health insurance. It is the same health insurance that retirees qualify for when they retire and qualify for the Social Security retirement benefit. There are various parts to Medicare. Part A is considered the hospitalization, and there is usually no premium to qualify for Part A. Part B is their medical services. So you go to your doctor, you go to a specialist, there's usually a monthly premium payment, and you have the option to choose Part B or not. If you don't want to pay the premium, then you won't qualify for Part B. Part C is considered an additional program that Medicare offers along with other insurance programs called Medicare Advantage. That also has a premium to it, but it depends on what programs you choose. Part D of the Medicare system is their prescription drug program, and there also is going to be a premium cost, and that is going to vary depending on what state you live in, what option of health insurance coverage, or excuse me, not health insurance, prescription drug coverage you're interested in, how much of a copay you might want to pay. So it's going to vary from person to person and also has variations depending on what state you actually live in. There's also some programs that the Social Security Disability Insurance program offers that once a person is on benefit, so now they're receiving a cash benefit from disability insurance because they medically qualify. And there may be a point where a person would like to re-engage in employment. The Social Security Administration's Disability Insurance Program has multiple incentives that encourage folks to go out and try to go back to work and be able to use some of these protected work incentives so that they can test their ability. Some people are going to be able to go back to work and do just fine. Other people may not be able to go back to work, but they're also not wanting to lose all of their benefits just in case. So you have all these variations of work incentives that I've listed that fall under the disability insurance program. You see the trial work period, and I've given you all the 2013 numbers, and be aware that those 2013 numbers may change in 2014. So these are the current numbers, and you see in red what the quick value is of a trial work period. It protects a person from losing any of their cash benefits while they're making a work attempt. The extended period of eligibility is a safety net. Once you've used up your trial work period, then you have a safety net and go into the next window called extended period of eligibility. You also will have extended Medicare coverage. A person could keep their Medicare for 5.5 years even though they may not be continuing to receive a cash payment, but will continue to be covered under their Medicare. There's also special rules for the blind. You can see they have a higher substantial gainful activity. There's also a protection for if a person needs to pay for things out of their own pocket to support their disability while they're working, they could get credit for that out-of-pocket expense and have it not be part of their earned countable wage. So you see that as an impairment-related work expense. Section 301, where a person needs to continue to be on benefits, but they're in a vocational rehabilitation program. Special conditions is when a person is receiving support in order to be able to earn wages. There's a great chance that a person could be earning what looks like the monthly SGA number of this $1,040, but because they need so much help supporting their ability to earn that, the Social Security Disability Insurance Program may not consider that substantial gainful activity, and they would continue to stay on the cash payment. Then there's a quick way for someone to get back on cash payments called expedited reinstatement. And then there's an additional program above and beyond all of these programs that are called the Ticket to Work programs, and you would then use your vocational services in your state or all of your work opportunity programs that would help someone get a job and keep a job. Now, I would love to be able to tell you that all of these work incentives are automatic. If a person is interested in utilizing some of these work incentives, there are requirements, and sometimes you actually have to apply for these benefits. That is done through your local Social Security office, or if there are programs and specialists that are working in your state, these folks would be able to help you apply and keep your benefits and actually interface with the Social Security Administration on your behalf. So these are the work incentives that you see listed here on this particular slide that belong to the Social Security Disability Insurance Program. So these are different work incentives that are different than the work incentives that will apply to the SSI program that we will get to in just a few minutes. We are now going to talk about we're going to leave the disability insurance program, and we are now going to talk about the other disability program that the Social Security Administration operates called supplemental security income. It's important that people make a differentiation between the disability insurance program and the SSI program. These two programs are very different from each other, and how wages are counted, how you become eligible for them, different with the exception of the medical determination. So if I'm medically eligible for DI, I wouldn't be medically eligible for SSI. Doesn't mean I'd qualify for both cash payments because there are other qualifiers to be eligible. The SSI program has both a medical determination and a financial determination. So you see here, supplemental security income, SSI, is also known as the Title 16 program. This program is not a medical term. It's an eligibility term. SSI comes from federal income tax that we all pay when we earn wages, so it's considered a taxpayer's dollar, where disability insurance is a dollar that comes from wages that we've all earned, comes out of our paychecks. If you look at your pay stubs, you'll see where it may say FICA, it may say OASDI. So we have actually put into the DI program where the SSI program money comes from taxpayers' dollars. One of the criteria for SSI is based on a person's financial picture. So how much unearned income are they receiving from a different source? Are they earning any wages? Do they have resources over a certain amount in any given month? So all those financial criteria pieces are also considered when they're looking at someone's eligibility to the SSI program. So it's not just medical eligibility, it is also financial eligibility, where DI is, do you have enough work history and enough dollars in your FICA work history record to draw, and do you meet the medical criteria? So one is enough work history and meeting the medical, and the other is meeting the medical and also the financial. How much resource, how much unearned income, how much wage are you earning if you are earning wages at the moment? Federal benefit rate maximum for an SSI payment that is strictly from the federal system in 2013 is $710 a month. The cash payment comes to that individual who qualifies on the first day of the month. If the first day of the month falls on a holiday or a weekend, the individual would get the benefit, the cash payment, prior to that first. So they have to have it on the first to be able to utilize the dollars. The health insurance that goes with the SSI program is called Medicaid. Now, Medicaid is the national term. Some states change what they call it in their state, but the national term is Medicaid. And the Medicaid program in every state is administered by the state, not by the Social Security Administration. So someone who is eligible for SSI then could go to the state and walk through the state Medicaid door, because every state have multiple doors into Medicaid. SSI eligibility is one of those doors that gets a person into the Medicaid system. Most states follow the federal SSI eligibility rules to also determine whether someone is eligible for Medicaid in their state. There are some states who change that Medicaid eligibility in their particular state, but most of the states follow the federal guidelines. Some states automatically determine Medicaid eligibility when a person becomes eligible for Medicaid. So in some states, I get my eligibility to the SSI program, and I will then get my Medicaid card in the mail. Some states require you to apply for Medicaid separately. And so once you're eligible for SSI, then you have to apply for Medicaid in some states. The fact that you're eligible for SSI is going to make it easier for you to qualify for Medicaid, even if you have to apply separately in that particular state. So Medicare goes with SSDI, Medicaid goes with SSI. And you could have some folks that qualify for all four of those. That would not be unusual for someone to qualify for SSDI and Medicare and SSI and Medicaid, because they're different programs.
Hi, folks. I think we might be having a little bit of technical difficulties. If everyone could hold on for 1 second, we're going to try to get our sound going again. Thanks. Once again, everyone, we are having a little bit of audio technical difficulties. We are trying to get Sharon connected again. Please hold on for like 1 minute. Thank you.
I'm here again. Sorry, folks. Nakia, can you give me an indication as to when I dropped off?
Sure. I'm going to take a look at the transcript. And the last thing we heard you say was you were talking about Medicare goes with SSDI and Medicaid goes with SSI.
Okay, so I was just repeating what I said. So now I'm going to go to the next slide, and the top of the slide says, what are Medicaid waivers? I apologize. For some reason, my phone line kicked off, so I'm using a different line. It's also going to be important for people to be aware that there are other additional programs that are offered in various states, and almost every state has what they call Medicaid waivers. They're going to vary from state to state because basically a state develops a waiver, has it approved by the Center for Medicare and Medicaid Services so that they can basically waive the state Medicaid plan rules for folks who qualify for the regular Medicaid. It may be you get additional services. It may be that you qualify differently financially, but every state has a different group. So I could live in one state and be on a Medicaid waiver that provides me with personal care assistance. And I then move to a different state And that other state may not have such a waiver, and even if they did, I might have to go on the bottom of their waiting list because I just moved into that state. Because most Medicaid waivers are a combination funding between the federal government and the state government, and they control the amount of folks that are eligible for Medicaid waivers because it controls the cost. So there's usually waiting lists in states who have Medicaid waivers. And usually the services that are in a waiver are not found in regular Medicaid. There could be specific disabilities that qualify. It could be a particular geographic area in the state. And then again, be aware that states, again, do not allow waivers to move from state to state. So each state has their own group of waivers. Most waivers are going to require eligibility to state Medicaid to also be eligible for a waiver. There are some exceptions to that depending on the state and depending on the waiver services that are provided in that program. The waivers are again administered by the state and overseen by Centers for Medicare and Medicaid Services, which is the federal part of the U.S. Department of Health and Human Services. Now remember that I'm on SSI now, and you're looking at, in the next slide, if I want to go out and I want to earn wages, and I'm on SSI, I'm going to be required to report my wages to the local SSI field office every single month. Even if a person gets paid once a week, you're going to want to wait until all of your pay stubs are given to you in that month, that are dated in that month, and turn them over in the first week of the next month. Remember to copy everything. Don't let anything out of your hands until you copy it first and then send it to the local field office. And what you're looking at right now on this slide is the basic formula for someone who is earning a gross wage, so in a month before taxes, and are also on receiving SSI. So I've earned $1,085 gross wages in a month. The SSI program excludes the first $20, and they call that a general exclusion. And they also give me a $65 earned income exclusion. So now the wage that they're counting is only $1,000. For every $2 that I earn, SSI is only going to count $1. So you see this division problem here. So the new countable wage is no longer $1,085, but only $500. So if I'm receiving the full $710 of SSI in the month, they're going to count $500 of my gross wages, and I will still receive $210 of an SSI payment, even though I've earned $1,085 in wages. So a person who's getting SSI and earning wages is always going to have more money to live on than if they're just receiving SSI. There's no time limit. As long as I'm both medically and financially eligible for SSI, I could earn wages forever, as long as I report them and as long as I meet both the medical and financial criteria to be eligible for SSI. So financially, it's much more beneficial to be receiving some SSI and earning wages than just living on the $710 a month. SSI also has a list of work incentives that are utilized when someone is on SSI and earning wages. These have details. You could go to the Social Security Administration's website and learn in detail each one of these work incentives. But again, I've listed here for you all of the SSI work incentives and a quick, in red, value. So a student earned income exclusion, there's criteria, but it excludes wages. so that SSI, if you meet the criteria of a student earned income exclusion, they may not count any of your wages. There's also a blind work expense, which is out-of-pocket expenses to support a person even though they're working and they also meet the blind criteria. 1619A is a work incentive that protects SSI recipients from substantial gainful activity. 1619B, which is, I encourage folks to learn a whole lot more about this one, allows a person to earn enough wages to where they may not be receiving any cash payment, but they would still be eligible for Medicaid. So it's a way for someone to be able to earn a lot more wages and still be eligible for Medicaid. Can't save any more resources. They have to meet the resource criteria, but they are allowed to earn more wages and still be eligible for Medicaid. So I encourage folks to learn a lot more. This is a wonderful work incentive to protect folks who want to earn more but are afraid that they're going to lose their medical benefit. The next work incentive that SSI offers is called a Plan for Achieving Self-Support, and it's a savings program to help somebody reach an occupation. So if you need to go to school to be a certified nursing assistant, it's going to cost you to go to school. It's going to cost you for books and supplies. It may cost you for transportation. This is a savings program that is protected under resource limitation, but allows you to use that savings to pay for those expenses so you can reach the occupational objective of being a certified nursing assistant. This belongs to the SSI program. Property Essential for Self-Support will protect some things that you own, including a bank account that you may use for a small business that will not count towards your resource limitations, which may then make you ineligible for an SSI payment if you go over the resource limit. But if you have, say, a bank account that belongs to a small business and the money that's in that bank account goes to the business, it could be protected under that resource limitation under the Property Essential for Self-Support. The next work incentive that you see here is called an impairment-related work expense. And it's different than the blind work expense because the blind work expense belongs only to those folks who meet the blind criteria definition under the Social Security Administration. The impairment-related work expense belongs to all other people that are disabled that don't meet the blind criteria, that have out-of-pocket expenses that they're paying for on their own, that support their disability in order to earn wages. Examples might be co-pays for medications, or co-pays for doctor's visits, or co-pays for transportation. Things that you're paying for out of your own pocket that support your disability in order to be able to receive the SSI payment. They will give you credit for those out-of-pocket expenses. Section 301, again, protects benefits when you're no longer medically eligible, but if you are in a current vocational rehabilitation program, either with state vocational rehabilitation or you're working with the federal one-stop system or workforce investment system, you would be eligible to continue to get your cash payment even though you may no longer be eligible medically until you've completed your vocational program. SSI also has special conditions and subsidies calculating the value of work. When you're initially applying for SSI, this would be very, very valuable. Expedited reinstatement is a quick method to get right back on benefits that you are no longer getting because you were no longer eligible for an SSI payment. Now, I need to also let you know the difference with 1619B, where it's protecting your Medicaid. You are still going to be eligible for an SSI eligibility, even though you may not receive an SSI cash payment. But 1619B keeps you in eligibility status with SSI and keeps you in eligibility status with Medicaid, even though you are not receiving a cash payment. But you're earning wages enough that the cash payment no longer is coming to you, because when they do this formula, and I've I went back one slide, if you were to wipe out your entire $710 because you're earning more gross wages, you would no longer be getting a cash payment of SSI, but you would then qualify for 1619B, which keeps your Medicaid and keeps you in SSI eligibility status, even though you're not getting a cash payment. So there's lots of ways that folks can have a better financial quality of life and still be eligible for SSI and eligible for Medicaid. These are the contact pieces of information. The three of us that work for the National Disability Institute who are fluent in these rules and regulations. And then also we've given you the actual website again for the Social Security Administration's website. I am now going to open it up because I want to make sure that you have enough time to answer questions, and it takes time for Nakia to read the questions and then for me to answer them. So I want to try to get as many questions as I can answered. And if you have additional information that I didn't cover that you have questions about, please don't hesitate to ask those questions as well. Nakia?
Hi, Sharon. I just wanted to say to everyone, if you have questions, please send them in using the Q&A box or the chat box, and I will convey them to Sharon. We have a decent amount of time left, everyone, so
yes.
Go ahead and send all your questions in. So, Sharon, we do have a few questions in so far.
Okay.
So the first one is, you have to have worked enough to be eligible for SSA disability, right? I looked into this, but I don't think I have worked enough. I have not worked for years because of severe back problems.
Okay, so now I'm going to answer. There's a couple of questions that are in with that question. First of all, SSA stands for the Social Security Administration. What you're asking about is the program that Social Security Administration administered, Social Security Disability Insurance. And in the question that you asked, yes, you have to have enough work credits in your work history to qualify for an SSDI payment. The qualifiers could be age-related, so someone who is between 18 and 25 are not going to be required to have the same amount of work credits earned as someone who is over the age of 31. The other criteria is you also, in order to qualify for a disability insurance payment, have to have wages earned in the most current 5 years of your disability eligibility definition and qualifying. So if, say, you've got a work history and you haven't worked in the last 10 years, you don't have a current work history to draw disability insurance. You also, folks, have to remember, too, that the qualifiers for disability insurance payments are different than the qualifiers for retirement payments. So you don't want to mix up those programs, even though it's the same pot of money that is paying out for disability insurance as it is for retirement. But the eligibility criteria is going to be different from disability insurance versus the retirement program. I hope that answered your question.
Thank you, Sharon. The next question is, when a child becomes 18 and now becomes the adult category, but has been getting SSI a long time, how do you help families so that the child can continue as an adult on SSI?
Great question. First of all, currently, medical eligibility criteria for a minor, which is birth to your end of your 17th year. The medical criteria for eligibility to SSI is different than the medical adult criteria. So if I'm a minor and I'm eligible for an SSI payment, it is because I met the medical criteria for a minor and the financial criteria of both the minor and the family. At age 18, a redetermination will need to be made to determine whether I still meet the medical criteria, but now as an adult, not as a minor. So minor medical criteria is based on the developmental milestones, your gross motor, your fine motor, your speech, your vision, your hearing. Your adult medical criteria is, does your disability get in the way of your earning what is called substantial gainful activity? And I'm going to go back to the slide so those of you who are looking at the slides can be reminded again of what those numbers are. It is, an adult must be able to prove medically that they're unable to earn in 2013 $1,040. So a person who's on SSI as a minor needs to be redetermined under adult definition medically. I hope that answers the question.
Okay, thank you, Sharon. We have another question about minors. Can a minor qualify for SSDI on a parent or guardian's earned income once the guardian has passed?
Yes, but it's not then considered, there's no medical criteria. All of us who earn wages and put into the system under the Social Security Administration, under FICA, if the parent who's earning that wage has minor children, and that parent opens up their work history either by retiring, passing away, or becoming disabled, those minor children will qualify to what is called a dependent minor benefit. There is no medical criteria. You do not need to be disabled to qualify for a dependent minor benefit. You just need to be the minor who is connected to that now open parental work history because that parent either retired, died, or became disabled and is receiving a cash payment. So it's not a disability-based benefit. It's a dependent minor benefit.
Okay.
Hope that answers the question.
Thank you. There were also a few other questions similar to that. And
okay.
for those that sent those questions, then I hope that this previous answer helped you. And if not, could you let me know and I'll try to get Sharon to clarify. Our next question is, if I have SSDI, can or should I apply for SSI?
Good question. First of all, I will tell you that if you are medically eligible for disability insurance, you are already medically eligible for SSI. Remember that SSI has also a financial eligibility requirement. The federal benefit maximum SSI payment is $710. So if you're receiving more than $710 on a disability insurance payment, even though you're medically eligible for an SSI payment, because you're making more than the allowable monthly maximum on the federal government payment of SSI, you have what SSI calls too much unearned income. So you don't financially qualify for an additional amount of money from SSI. Let me give you another example. If I'm receiving $520 a month from DI, so that's my DI payment. My work record, I have a history of work history, and based on the amount of money that I earned when I was working, I qualify for $520 a month of DI. I also am medically eligible for SSI. So SSI says, Sharon, we're going to have to count all but $20 of your DI payment. So we have to count $500 of your disability insurance, and we also have to make sure that you meet the resource test. So we need to know, do you have more than $2,000 in a savings account? Do you have stocks and bonds? Do you have retirement money? Do you have resources that go over the $2,000? if I have no resources and I only have my disability insurance payment of $520, SSI says, okay, if the $710 is the maximum SSI payment in the state that you're living in, we will subtract $500 from the $710, and we will then qualify you for an SSI payment of $210. So you'll receive $520 from DI, because that's what you're qualified for. SSI will then qualify you for $210 of an SSI payment. So you're the kind of person then that would have SSDI and Medicare and an SSI payment and Medicaid. So you're always going to be medically eligible. It's whether or not you're financially eligible to receive an additional payment from the SSI program when you're on DI. Hopefully that helped.
Thank you, Sharon. We have someone needed a quick clarification. Anyone on SSDI is eligible for Medicare?
24 months after the date of eligibility will qualify for Medicare. Yes.
Thank you. Our next question is, can you be eligible for a state waiver program if you are receiving SSDI and Medicare?
Yes, you could, if you meet the criteria of the waiver in that state. And again, it depends on the waiver, how it's written, and it also will depend on whether or not you can qualify for Medicaid, depending on the criteria financially for that particular waiver. So if you are getting DI and Medicare, there's a possibility that Medicare is not going to buy what Medicaid waiver services might buy. Medicaid in the state may not buy those waiver services either. You need to make sure that you understand the waiver that you're asking about and what the eligibility criteria is, both financially and whether it's the disability that qualifies the person, is it the geography in the state that they're living in. So there's different criteria than regular Medicaid. So waivers are different than regular Medicaid state plan eligibility rules.
Thank you. I think we talked about this briefly earlier. Can you provide an example where someone might be eligible to collect both SSDI and SSI?
Right, and I did do that once, but I'm happy to repeat it because some of this stuff is very complicated and people need to hear it over and over again. So I'm going to give you another example. I applied for Social Security disability insurance. I submitted my paperwork, and disability insurance saw that I had a work history and I met the medical criteria that defines me as unable to earn substantial gainful activity because of my disability. And I am now going to get a payment of $420 a month from disability insurance. And I don't have to meet any financial criteria because I can have $1 billion in the bank and still qualify for disability insurance payments because I earned it. I put it in from my work history. So there is no financial hook to be eligible for disability insurance or Medicare. 24 months after I receive my disability insurance payment, I will then qualify for Medicare. Now, how do I also qualify, if I qualify, to receive an SSI payment? SSI will say, Sharon, you've met the medical test, because to be eligible for DI is the same medical test as to be eligible for SSI. Now SSI has to determine, am I also financially eligible for an SSI payment? So they're going to look at what else I'm receiving every month. One of the things they're going to be required to look at is my SSDI payment. SSI calls SSDI unearned income. So they're going to look at that $420 a month that I'm receiving from DI, and they're going to say, Sharon, we have to count $400 of that $420. The $20 we're going to give you as a general exclusion, so we won't count that $20, but we have to count $400. And I live in a state that the maximum SSI benefit is $710. SSI is also going to have to look at, do I have a savings account? Do I have this $1 billion that I have sitting someplace? If I do, then I'm not going to meet the eligibility test and I won't qualify for an SSI payment. If I don't have any assets or resources, or what I have is under the $2,000 that I'm allowed in any given month, then SSI says, okay, Sharon, you meet the resource test and you are receiving $420 a month of unearned income, and you're not earning wages currently, so we don't have to look at wages, but we are required to look at your unearned income. So we can't give you the full $710, but they'll take the $710, subtract the $400 of the unearned income they're counting, and I will then receive $310 of an SSI payment, because I'm receiving $420 of a DI payment. I will then, depending on the state that I live in, have to apply for Medicaid separately, because I will be eligible for Medicaid, or I will automatically, in some states, get my Medicaid, because I'm going to be automatically eligible for Medicaid in some states when I get at least $1 of an SSI payment. So that's another example of how you would be able to get an SSI Medicaid eligibility and an SSDI Medicare eligibility. Same person.
Thank you, Sharon. So we had a couple of questions come in about the interaction between receiving SSDI benefits and your Social Security and retirement. And they both basically boil down to, if you are receiving SSDI currently and then you become 62 and are eligible to receive your Social Security retirement, does the SSDI affect your retirement? Does the retirement affect your SSDI? Can you have them simultaneously?
Good question. First of all, one thing we all need to remember is it's the same pot of money that pays out SSDI that also pays out a Social Security retirement. It's just how you qualify to draw the money. So prior to retirement age, if you're no longer able to work because you're medically eligible, that pot of money will pay out under disability insurance rules. If you meet the retirement criteria, you do not have to prove medical eligibility. You just have to prove you have enough work history and you meet the age criteria. There is a difference in how they formulate the amount you receive under disability insurance versus retirement. So a person who could be under the retirement age could be receiving a disability insurance payment because they've been on the benefit and met the medical criteria. When they reach retirement age, they could flip from disability insurance rules to retirement rules. The only caution is to make sure you're going to maintain your eligibility to the health insurance Medicare. That's the only difference between the retirement program and the disability insurance program, and also the amount of money you may qualify for under the retirement formulation versus the disability insurance formulation. But it's coming out of the same pot of money. It's just the criteria in which you qualify for.
Thank you, Sharon.
You're welcome.
So this question is talking about the application process. How do you handle if you cannot reach the person that's handling your paperwork during a reconsideration and you need to make sure that they have all of the medical records that they may have not have had previously?
Great question. First of all, remember that you really don't want to be calling the Social Security Administration. The Social Security Administration does not make the medical decision. The medical decision is again made by the state contractor, Disability Determination Service. If you go onto the state website and you put in their search engine, Disability Determination Service, you will get the phone numbers for the state agency that you want to contact. Once the paperwork has been given from the Social Security Administration to the Disability Determination Service, there will be a technical analyst assigned to that case. That's the person that's going to go after the medical evidence, go to get the doctor's information, everything that you have given them on the application, hospitalizations, various specialists. What you do want to do, and that's why it's a great question, you want to stay on top of those folks, because if they make a request of the medical resources at least 2 times, but the medical resources don't give the information to the Disability Determination Service, people will get denied, not because the Disability Determination Service doesn't think you're disabled, but they don't have the factual medical documentation they're required to collect to prove it. So when you make regular calls once a week to the Disability Determination Analyst that's assigned to your case, you can ask them, did you get Dr. John Doe's information yet? And they'll say, no, we didn't. Then you could call the doctor's office and say, please make copies of the information, because I will get denied if they don't get your information ASAP. You could also request from the Disability Determination's technical analyst, would they be willing to give you just a little bit of time to see if you can get the medical evidence from your doctor to that office? So when you're in a regular contact with the Disability Determination Service, you can negotiate with them because you're acting on your own as your own advocate, and you're trying to stay on top of the decision-making process to get them what they need so that they can make an accurate decision rather than denying you and denying you and denying you, because it may not be that they don't think you're disabled. They just don't have enough of the evidence to prove it, and so they're required to deny. Hopefully that answers that question.
Thank you, Sharon. We have a couple questions about 1619B. The first is, if an individual who has been receiving SSI no longer gets a cash payment due to high wages, how does 1619B kick in?
Okay, first of all, it doesn't really matter whether the wage is high or not, because somebody could be getting a combination of a DI payment and an SSI payment, so they're not getting very much SSI. But as soon as the SSI cash payment is fully eliminated because of the SSI wage calculation, and again, I'm going to go back to the wage calculation so you can see what it looks like. If I wipe out my entire SSI payment, whatever that SSI payment is, because of the wages that I earn, I wish I could say to everybody on the call that 1619B would be automatic, but it's not always automatic. And so I encourage folks to apply for 1619B at their local Social Security field office. What that's going to entail is to show that you've been reporting your wages, you're medically and financially eligible for SSI, but because of the wages you're earning, you're no longer receiving a cash payment. They will then enter into their federal code system that you're eligible for SSI, which is then a message that goes to your state Medicaid office that shows that you're still eligible for Medicaid, and that's how you keep your Medicaid. Do not go to the local Medicaid office to get 1619B. It does not belong to Medicaid. It belongs to SSI. But remember, you also still have to be under the resource limit. So you might have a lot of wages, but you still can't save more than $2,000 for an individual and $3,000 if you're a married couple. So you still have to maintain all of the financial eligibility criteria to maintain your connection to 1619B and your connection to Medicaid.
Thank you. And the next 1619B question was, which is better for a person to apply for, 1619B or the Medicaid buy-in program?
I encourage folks, you can do both. You don't have to pick one or the other. Depending on the state that you live in, sometimes you have a threshold that you have to meet against what the federal poverty level is in some of the states' Medicaid buy-in programs. But there is nothing that says that you can't be in both. They're two different programs. The value of 1619B for a person is that if they lose their job, they automatically go on a cash payment, back on a full cash payment of SSI. The disincentive to staying on 1619B is you're not allowed to save any more than $2,000 of resources. Most Medicaid buy-in programs have a higher resource value, so you can save more money, and most of the Medicaid buy-in programs in the states have a higher earned income, annual earned income level. So 1619B is going to have a income level that's going to have a max depending on what state you live in, but it's certainly a lot more than being on SSI. I could say in some states it might be $35,000 of the state threshold to still be eligible for 1619B, and that same state might say, well, in our state you can earn $45,000 under the Medicaid buy-in program. In the state that says there's $35,000 in earned income, annual income threshold limit, you're still only allowed to save $2,000. In that same state that says you can have $45,000 of income, we're also going to say that you can have $10,000 in resources. So it depends on what a person understands of both sets of rules in the state that they live in. So it's important for them to understand the Medicaid buy-in rules and what the limitations are in their state under 1619B, because Medicaid is administered by the state, and there's always a state threshold under the 1619B formula as well from state to state.
Thank you, Sharon. And a couple of folks have been sending in a couple questions, one asking when the PowerPoints are going to be available, and two, if the answers to the questions that we've gone over today would be available. And to answer the first question, the slides are up right now on our website. I will put the URL in the chat box here in just 1 second. Or you can just go to our site and look for the webinars. The slides are there. And about the questions, the transcript for today's webinar will also be available as soon as we're done. That'll be on the site as well. So you can go through the transcript and look at some of the questions the question and answers that we've gone over today.
And also, just so you're aware, too, if you look at the last slide, for those of you who are looking at the slides, and I'll give you the information on the emails, but if you have questions after the call, and you can still send in those questions and we'll still respond to them. You can see that my email address is here, and if those of you who are not looking at the slides, it's S as in Sam, Brent, at ndi-inc.org, or you can send in the questions to Nakia so that they get posted, and they will be answered, and I will answer all those other questions that come in.
Thank you, Sharon. We have about 15 minutes left, so we're trying to get through as many questions as possible. Okay. Our next question is, if you're going through the appeal process and you have new medical results that show or prove a disability, should you submit to the Social Security Administration immediately, or should you wait for your court hearing?
I encourage folks, as soon as they get the information that you think would qualify you, because there are times when even though your process is in the administrative law judge system where they're looking at all the documentation, even if you had an attorney that is helping you do this, if you can submit something that will then have them eliminate the fact that you have to wait for your date, to go to court to see the administrative law judge that proves that you meet the criteria, because there are people that are going to be looking at the documentation all along before it even gets to the date on the calendar. They could go ahead and make you eligible before you ever reach your date. The concern I have is that it gets to the right person, and I cannot encourage all of you enough. Don't let anybody send documentation anywhere until they've got copies that they're going to maintain, because things get lost. The Social Security Administration is a huge system, and I will tell you that they lose things, or it might go in a wrong file, or it doesn't get where they want it to go fast enough because they're overworked and don't have enough staff. So I encourage people to keep their own files, to keep copies of everything that they've submitted. But I also would encourage you, if you are in the appeals process and you have an advocate or an attorney, it's important that you get that documentation to that individual that's helping advocate for you. They will know exactly where it needs to go to see if they can stop that process on the court calendar, and somebody could approve it in between. So you don't have to wait to go to court. You should always turn in information as you get it that's pertinent to making you possibly eligible.
Thank you. Our next question, will the Affordable Care Act affect those SSA beneficiaries receiving both Medicare and Medicaid?
That's a loaded question. I wish I was so fluent on the new Health Care Act that I could answer that fluently, but I can tell you that it's going to vary from state to state. We do not know yet the full impact. I do know that the rules right now under disability insurance and Medicare, there will still be the 24-month waiting period. So Medicare is not going to come to DI recipients any faster. That was one of the things that we were hoping that was going to occur. And right now, it's not, doesn't mean that it will not in the future, but right at this moment, the 24-month waiting period will still hold. In terms of retirees, the Affordable Care Act will modify how their premium costs might look, their supplemental policies might look, and the same way with Medicaid, what we're required to choose. But again, I wish I was fluent enough right at the moment in terms of what's going to be implemented in 2014 to answer that question state by state. But as of yet, I cannot do that. I'm not sure I know anybody that can at this moment. But there are people that are detailing out the Affordable Care Act and disability and Medicaid and Medicare. So I can tell you that the National Disability Institute is right there working on this as we speak. So hopefully at some point we'll be able to give you a cheat sheet to make it easier for everybody else to understand as well.
Okay, thank you. Let's see. Can you explain a spend down?
Yes. Spend down has to do with someone financially qualifying in their state for Medicaid because they're not financially eligible. There is a formula that the state Medicaid system uses to determine whether someone who's got too much unearned income. So let's use the example again of disability insurance. I'm getting $1,000 a month of disability insurance payment, and I'm receiving Medicare. But I know that I have some things that Medicare will not pay for, and I can't afford my out-of-pocket for a certain medication, and Medicare will not pay for it. Or I know I'm going into the hospital, and Medicare is only going to pay 80%, and I know I'm not going to be able to afford the 20% that's going to get billed to me because I'm only getting $1,000 a month of disability insurance. I want to find out if I can qualify for Medicaid as well. Because someone is receiving $1,000 a month of unearned income and the eligibility criteria for Medicaid in that state is the same as it is to get SSI, I don't automatically get Medicaid. But medically, I qualify for Medicaid. I just don't qualify financially. So I go to the Medicaid office, they subtract standard deductions that they will look at as far as I am concerned, And once they get done subtracting all of the things that the state allows them to subtract, the leftover number is what I have to spend out of my pocket first before Medicaid will cover anything else. So let's say my spend down in a month is $300. So the month that I go into the hospital, because I can pay the $300 the month I go into the hospital, I meet my spend down, and then I use both my Medicare and my Medicaid as my insurance, and the 20% that's left of the hospital bill, once I pay the $300 spend down that month, will get covered by Medicaid. I will not be responsible for the full 20%. I only have to meet my $300 a month spend down that was calculated by Medicaid to make me eligible that month for Medicaid. So it basically is they're making a person financially eligible for Medicaid based on the spend down formula in a state. Every state, some states call it share of cost. Other states call it spend down. But every state has such a system.
Thank you. Clients applying for voc rehab services like DRS find themselves in a situation where on one end they need SSI, SSDI benefits and would probably qualify for them because they meet both of the criteria, but they cannot claim that they cannot become employed because of the purpose of becoming eligible for VR is to get employment. So is there any guidance on that situation?
Okay, first of all, what you've just identified is what NDI, we're actually working on a research project right now, because exactly what you said. First you have to prove beyond a shadow of a doubt that you're unable to earn wages over SGA to prove that you're medically eligible. Then the Social Security Administration has all these wonderful work incentives that says, okay, now that you're on benefits and maybe you've recovered a little bit, we've got all these wonderful programs to help you go back to work. Well, when you go to the Department of Rehabilitation, and every state has a vocational rehabilitation system, basically what you're saying to them and what they're required to look at is your capability of returning to work. But there's nothing that says that you're going to be able to return to work at full capacity. So vocational rehabilitation is there to do an assessment to determine what you might qualify to do given your disability. So you may have been a roofer before you fell off the roof, and now you no longer can be a roofer because your disability won't allow it anymore. But now you can sit in a chair and you might be able to become an accountant or a bookkeeper. Well, it would be the job of vocational rehabilitation, if you meet their criteria, to help you qualify and become a bookkeeper because you no longer can be a roofer. So you're not restricted to going to vocational rehabilitation that says you can go back to work. That's what they're there to do. If you're already on disability insurance or SSI and you go to vocational rehabilitation, it's their job to help you find employment. Then when you get jobs and you start earning wages, the rules under DI's wage rules would apply to you, or the rules for SSI's rules would apply to you. If you are not on benefits at all, but you meet the criteria to go to vocational rehabilitation to help you get employment, you're saying you're ready for employment and your disability is not getting in your way. So you have to make the decision, is your disability getting in your way from earning a maximum, a minimum amount of money called substantial gainful activity in a month, or are you needing to apply for benefits, but that doesn't mean that you still won't be able to get services from their state vocational rehabilitation system. So it is a little confusing because you have to prove beyond a shadow of a doubt that you can't work, and then you want to go to vocational rehabilitation to have them help you get a job. But that's what they're there to do. I know it's a confusing answer because the question was right on the money in terms of proving one way or the other, but that's the way the system is working currently. And until the Social Security Administration changes their definition of medical determination, that's what we have to work with. So,
thank you, Sharon.
You're welcome.
Another question we have in, And you may have covered this earlier, but again, it's always good to get some of these things reiterated. If you have a Medicaid waiver, can you qualify for SSDI or SSI?
You sure can. One has nothing to do with the other. Remember that Medicaid waivers are administered by the state, and they're going to be varied from state to state, depending on what the state feels they want to create for a certain population or a perfect geographic area. That does not have anything to do with your medical determination. As a matter of fact, if I'm on a Medicaid waiver and I meet the criteria in a state, I would want to use that as medical evidence to help me qualify medically for SSI and disability insurance. It would be another piece of evidence that shows that I have a disability. Anybody who is under an individual education plan, that would also be considered medical evidence because it shows that you need support services from the education system because you have a disability and you're unable to do it on your own. So any of that kind of documentation can be used as medical evidence to qualify for SSI or GI as well.
Thank you, Sharon.
You're welcome.
I have a client with quadriplegia who resides in a nursing home because he needs 24-hour care. The client is adamant about living in the community. Is adamant that living in the community is not an option for him, but he wants to work. Is this possible with institutionalized long-term care Medicaid? Is 1619B an option in this case?
Well, if I'm earning, okay, this is a multi-answered question because it also depends on whether the state has implementing what they call money follows the person. So if I'm a person that's in an institution, let's say I'm in a nursing home, and I would like to be in the community, will money follows the person's programs meet the needs that I have to live in the community? And if a person is adamant about wanting to live and work in their community, even though they need the care that's required, if you look at all the programs that are in the state that will support that, Medicaid waiver might be dollars you could use, money follows the person could be dollars you could use, Medicaid could be dollars you could use. It depends on the state, again, whether they have all those programs and what those programs look like and buy. But even if you're in a nursing home and you want to go out and earn wages, there is nothing that stops you from doing that. And if you qualify for SSI and you're earning wages and you earn enough wages that zero out your SSI, you would qualify for 1619B.
But
I would look at all, yep, and okay. I would look at all the programs that are available in the state for someone who needs 24/7 services. There are lots of folks who utilize multiple programs in a state, and they package the support needs and dollar needs to have a person live in the community rather than a nursing home if that is what that person wants to do.
Thank you. So we're almost at the end. I'm going to ask one more question, and then I will try to send all of the unanswered questions to Sharon. And if anyone has a question that was not answered today, they can email her at sbrent@ndi-inc.org. So our last question will be, is there a time limit that a person can earn the $1,040 per month and still receive SSDI as a disabled person?
Okay, so now the question is, are we talking about a person who's on DI earning substantial gainful activity? First of all, is it truly substantial gainful activity? The question has to be asked, does that individual need any kind of support in order to be able to earn that money every single month? Are they paying for things out of their own pocket? Are they getting services from a provider with transportation or job coaching? Is it customized employment? How is this person able to earn this $1,040 a month? If they are really able to earn it on their own without any support, yes, there is time limit. So the first window, and I'm going to go to a slide that gives you the work incentives for disability insurance. You see the first window of time is called the trial work period. There is, if you earn $750 a month or more, you will earn one of those months. If you are able to earn 9 months over a 60-month window, you will leave that window of protection and go into the next window of protection, which would be extended period of eligibility. So under disability insurance, you have windows of protection, but the key component is the person really able to earn substantial gainful activity 100% on their own. If not, then you need to look at some of the other work incentives, like impairment-related work expense, special conditions and subsidies. Those are the other kinds of programs that you'd want to look at and submit documentation that says, oh no, this person is unable to do this without having a job coach there 3 days a week. So that agency would be considered special conditions. They're not able to do it on their own. Prove it. Send me the documentation, send Social Security Administration the documentation, and then even if the person is earning $1,040 gross a month or more every month, they would not be able to do that unless they had these services under special conditions and subsidies that you can prove because an agency is documenting what services they're providing to this individual that allows them to earn that kind of money. So it's important that you look at the person, what the person needs in order to do the earning, and submit that documentation. If the person is able to do it on their own, then yes, there are time limit windows. Trial work period, extended period of eligibility.
Thank you, Sharon. So that's all the time that we have for questions today. Again, if you need to contact Sharon following this webinar, you can see her contact information here. The slides for today's webinar are up on our website, and the transcript will be available in about an hour or so you can download that and check out the answers to some of the questions. I just want to let everyone know, again, Part 2 will be happening on Thursday, September 19th from 3 to 4:30 p.m. And following this webinar, you will be emailed a link and a password for Part 2. If you're listening by phone and not logged into the web, I need you to email me at nmatthews@ndi-inc.org so that I can send you the login information for Part 2. I'd again like to thank all of NDI sponsors for their wonderful help in doing our work. And thank you again for joining us today, and we hope to see you on Part 2, Thursday, September 19th at 3 p.m. Thank you, everyone, and thank you, Sharon.
Thank you. Bye-bye, everybody.